Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be going over how to use a dip belt correctly for your gym exercises with lower back pain. Hope you enjoy. So knowing how to use a dip belt correctly with your gym exercises if you have lower back pain is essential to avoid aggravating yourself. Well, I've taught this topic to many of my patients as well as my online consult clients. One of the recent inquiries we had with the subscribers that read into the channel asked this question. I thought it was a great topic to cover in a video. So let's go through it. First of all, you have to understand that regardless of your lower back anatomical diagnosis, meaning whether you have degenerative discs, herniated discs, bulging discs, whether you have spondylolisthesis, stenosis, sacroiliac problems, whatever Facet syndrome or anything else, strains, sprains, chronic issues, you have to realize that there's a certain position of neutral spine that's the safest position for your back. Now, for most people with extension type aggravations such as spondylolisthesis, stenosis, Facet syndrome, that means that if we increase the arch of the lower back, it typically is going to aggravate our symptoms. Now, that doesn't happen all the time with those diagnostic entities, but most of the time. Conversely, people with disc problems, degeneration, herniation, bulges, chronic flexion sprains in the lower back, they're going to be aggravated when we have too much flexion or when we lose the curve in our lower back, the lower back flattens out and we come forward. Now, knowing what your unique neutral spine is based on an analysis of your body. If you're going to use a dip belt, if you're going to do any core exercise, if you're going to train legs or upper body heavy, you have to know how to stabilize your low back. Now that's different and separate for all of us. Just because you have spondylolisthesis doesn't always mean that you need a tail under a posterior pelvic tilt. Many times it will, but not always. You have to base your position of where you want to hold your lower back in neutral or a safe position based on an analysis. That has to do with not only anterior and posterior pelvic tilting, what aggravates your pain, what feels better, but if you have a tendency to hip hike, if you have one leg that comes out, if you have a tendency to lean to the side, if you have more flexibility rotating with your torso and pelvis to one side versus another, if you have weak or inhibited multifidus stabilization muscles in the lower back, if when you engage your core and you pull your lower tummy in and contract your transverse abdominis, your internal oblique fires on one side. You need to know how to correct and set yourself with all these things in a neutral spine and the associated correct muscular stabilization contractions, known as your RPI, or reverse posture isometric, before you do any dipping exercise, before you do anything else. So with that in mind, and if you don't know how to do that, finding a neutral spine, that information is available on any of our products at the painfreeandfit.com website. So once you understand what your neutral spine is, you need to think about two basic things when using a dip belt. Number one, is your pain aggravated with anterior pelvic tilting, meaning where the pubic bone goes down and the tailbone goes up, increasing your lower back? Or is your back pain more aggravated with posterior pelvic tilting, meaning where the tailbone goes under, pubic bone comes up, pelvis tilts backwards, and it flattens the lower back? Because the position of the dip belt and how you use it is going to be tailor-fitted for that unique scenario. So for instance, in a typical dip belt use, and it doesn't matter again, if I have a weight that's attached, now I could use plates, I could use bells. For the purposes of demonstration, I'm just going to use a 20-pound bell here. A typical dip belt setup, the belt is behind us, and it's cutting into the lower back or the top of the hips, and the weight is in front of us. Now, again, you're going to be using this for more than dips. Whether you're doing dips like this, whether you're doing chins, pull-ups, whether you're doing sumo squats on an elevated surface, whether you're using a dip belt for squatting or lunging walks, whether you're doing lateral work with your dumbbell, it really doesn't matter because the position of the belt with the weight in front has a tendency to anterior tilt the pelvis, meaning that weight pulls forward and it increases the arch of my back. Now, if that's the direction that aggravates my pain, this is a definite no in terms of a setup for my dip belt for you. If that's the issue, you'd rather turn the belt around and have the weight behind you, because now when the weight is behind you, whether it's a bell or a plate, the belt has a tendency to pull your pelvis into a posterior pelvic tilt direction. That's much safer for someone with extension type lower back pain who's aggravated with anterior pelvic tilt. It's assisting you in holding your neutral spine. Typically, any exercise you're going to do, you're going to keep a little bit of posterior pelvic tilt in to avoid that increased arch in the lower back. So in this instance, you'd want to do all your work, whether you're chinning, pull-ups, whether you're dipping, whether you're doing sumo squats, you're going to use that weight behind you, assisting your neutral spine or your RPI correction. Now, conversely, if you have a problem that's aggravated with flexion, a bell behind you is not going to be the right thing, because that's pulling your pelvis backwards, inviting posterior pelvic tilt, and flexing the spine. Many disc issues are like this, whether you have herniation, bulges, degeneration. A weight behind you is actually going to be deleterious for you. It's going to aggravate your pain, likely, because it's inviting that flexion in the lower back. So here, you would want to go with the more classic setup, where the weight's in front of you, and it's causing a slight anterior pelvic tilt. Here, because you're anterior pelvic tilting, the pressure on the front of the discs is decreased. You're compressing more of the facet joint in the back portion of the disc, and that many times helps to relocate the fluid or the nucleus in the disc back to a more centered position. This is at the heart of all extension spinal rehab. So here you want to use it in the front, because you know part of your RPI neutral spine is anterior pelvic tilting. So you want to have the weight in the front so it supports that correction. Keeping these tips in mind when using a dip belt is essential, but also realize that sometimes using a dip belt for low back problems, regardless of anterior or posterior pelvic tilting, can become aggravating. Because if you have a chronic sprain, if you have a low back that has muscle spasm that's acute, if you have, let's say, a hot disc problem, meaning there's a lot of pain with your disc, the whole idea of having weight on the pelvis and suspending yourself either with dips or pulls, it's going to pull your pelvis down away from your spine. It's going to stretch your lower back. And although in chronic problems, many times that's beneficial for chronic spinal problems, in an acute problem where you're having a lot of pain, spasm, something's been aggravated recently, that type of stretching can actually irritate your discs. So you think you're doing something good by stretching your lower back, having the weight hang from you, but in reality it's aggravating your disc problems. It's aggravating an acute flexion or ligamentous stress or sprain. It's aggravating an instability problem in your lower back, where axial or long axis distraction or stretching is going to irritate you. So be careful. Those types of cases, you're better off using the weight somewhere else. You're better off using bands, let's say, across your shoulders when you're dipping, so the lower back isn't having this extra stretch that's going down through it, aggravating symptoms. If you like this video on dip belt use for lower back pain, check out our channel. Subscribe to it. We got a lot of great videos out there to help you. Questions or comments, as always, write in. I'll do my best. Like this topic was one of a subscriber's questions. Please, if you have a topic that is of interest to you, you'd like some advice, write in. The rest of us may like to learn from it also. If you'd like to get a great program to figure out how to analyze your lower back, how to check out your biomechanics, what your stability and posture and movement issues are, how to find the neutral spine that's unique for your condition, check out any of our low back products at the painfreeandfit.com website. Any of the fast track programs, the low back healing exercise, they all have a complete analysis you can do on yourself and your situation. They also instruct you on the corrective stretches, the stability exercises, the strengthening exercises, how to design a program and get back into sports and fitness, all to advise you in terms of self-treatment, self-rehab, how to get out of pain, and how to get physical again without hurting yourself. I hope you enjoyed this video on dip belt use for chronic lower back pain, and it helps with your issues.